Hey, welcome back to Basically EMS. I'm Chris, and we have the man, Wade.
Hey.
Who apparently I forgot to introduce you last time.
Yeah,
so.
only took it a little personally.
Yeah,
but it's fine.
I know you didn't complain at all about it.
I talked to my therapist about it, and she said I was being a baby, so I don't know.
It's true. I mean, it's true. You know, I just thought you are a man who needs no introduction.
Flattery will get you somewhere, Chris.
I know.
Be careful.
Yeah. I've obviously been thinking about what I'm going to say now to butter you up before we do this.
It's working.
Yeah, I know. Starting off with some levity before we talk about drowning. That's a choice, I guess. Maybe not the right subject to joke around about first, but let's talk about some drowning. So yeah, this is Basically EMS. We're going to talk about drowning today.
Yeah.
Have you ever had any drowning patients?
I had one, but it was very, very quick. It was a kid, I want to say like 4 or 5, out by the pool with Grandpa. Grandpa was watching for the day. Grandpa's like, I went inside to grab a towel. It took me maybe all 5 minutes. I came out. He was face down in the pool. I pulled him out, started chest compressions. When we showed up, he had clearly vomited, clearly eaten a big breakfast as well. And then, it was a lot of management on the way in. But yeah, nothing, we didn't have to work him or anything. I do remember the parents being really mad at Grandpa, and it was one of those like, I get it, but also this guy saved your kid's life. So
yeah,
balance.
Yeah, it's interesting. And I've been on a number of drownings. I feel like I was always white cloud, but like proportionally high for drownings. I think than most people. I think I've been on 4 or 5.
Oh yeah.
And there's a couple I think that will be really relevant for what we're talking about here. That we'll get into, but it's interesting. I feel like there are and we'll talk about kind of the normal cases for drownings. And I feel like it's pretty black and white of like the things that are involved, kids with pools and, those kind of things.
Right. Alcohol.
Yeah. Prevention is really the biggest thing for drowning. And that's not what we can do in EMS, but really, realistically, that's the best thing we can. It's like 98% of, fixing drowning is prevention with drowning. So, drowning. And if you're new to this, new to EMS, then you probably kind of heard these definitions and what we're going to talk about, but there's a lot of terminology, and even doing research for this, looking at different protocols and stuff, that they're still using kind of outdated terminology. So we'll try to, make sure that people are on the right page with the right terminology of everything. So, but drowning is the process of experiencing respiratory impairment from submersion or immersion in a liquid. So, when I was working in the field, the department that we worked for did a really, really good training on drowning. And so the training was done by Dr. Justin Semsrott. Hopefully I'm saying that correctly. He is one of the guys from Lifeguards Without Borders, and he's kind of like a worldwide expert on drowning. So a lot of the stuff that we'll be pulling is pulled from him. But one quote he had that I thought was really, really good for understanding drowning is that drowning is a brain problem, not a lung problem. And so we'll talk about kind of what that means. But I think that really kind of encapsulates what drowning is and the problem. People have the wrong opinion of what drowning is, right? Right.
It's a real misconception because everyone, in the movies, they're breathing in all this water and and it's not necessarily the problem.
Yeah. So, and we'll cover it, but it's really important to remember this is a neuro problem, not really a lung problem, right? And if you're interested in kind of watching some of the videos of the lectures that Dr. Semsrott has put out, we'll link them in the description on YouTube. If you're listening to this on YouTube, we can maybe link them. Sabrina, I'm not sure. Yeah, I think we could link them on the podcast as well. But there's a video called Pre-Hospital Treatment of Drowning that he does. It's like a 30-minute lecture. And then the Ada County Paramedics Training Division YouTube channel has a 4-part series. And I think that's what we did for our training that's public that you can watch. So if you really want to go more into depth in drowning, I would really recommend checking out those resources beyond just this, because they're really, really good. Lots of good videos that we're not going to be able to put in here, those kind of things. So highly recommend checking those out.
Yeah.
With drowning, you might have heard the terms wet or dry drowning as well as near drowning, and those are all gone. Those are not terms that we use anymore.
Super outdated.
Yeah, very much outdated. And these are the ones that I was seeing in current protocols of different places. Even I was trying to look for California, Florida, places that you would think would have more up to date, and a lot of them still have these terms in places that have what I would assume would be a higher prevalence of drowning patients.
Just because there's more water, that makes sense.
Yeah, places that have more pools, like here in Idaho, nobody has a pool in their backyard. California, Florida, 33% have a pool in the backyard.
I'm curious
right?
about states like Arizona and New Mexico also, because it's so hot, everyone seems to have a pool.
Yeah, exactly. I thought it was interesting, and we'll get to it later. But Salt Lake or Utah as a state has a really progressive drowning protocol, which I was like, interesting.
Right,
It's
that's the one.
the desert.
We'll get to it, but you were talking about matches kind of what that training by Dr. Sims brought.
Yeah,
Sims
what the drowning experts are kind of pushing as far as training.
Right.
So yeah, those are not terms we're going to use anymore. Now we will use fatal or non-fatal drownings, essentially, because if they were submerged in liquid that caused a respiratory issue, or not a respiratory, that caused some sort of hypoxia or something, it's going to be a drowning, whether it's fatal or not fatal. So wet or dry drowning, it's kind of interesting that I'm trying to think of where I have this in the notes. I think it comes up a little. Oh, it's right here. So wet or dry drowning was kind of an old school term for whether there was whether they took a lot of water into their lungs, and they have found that even during autopsy with the laryngospasm, most patients have 30 mLs or less of fluid in their lungs, which is not a significant amount.
No, especially if you consider like tidal volume space of air is 500. Right.
Yeah, so very minimal. And so that's why the dry drowning and wet drowning isn't really a real thing. And so I think it was pushing people towards like, oh, we need to suction and all this. And that's not necessarily the case. So those are outdated terms. And then one big thing that was talked about for me when I went through EMT school, paramedic school and everything was like salt water versus chlorinated water versus fresh water and all of that. And it doesn't seem like that's really a relevant thing either.
I feel like that would be more for like long-term management issues, like when they're in hospital, do they have to balance out the sodium content that's now in there or whatever?
Yeah. And even that was addressed in one of the things I was looking at for research on this. And apparently there was a study that was showing that salt water does have an effect and whatever. And I think they were using dogs. And so I think they were using like 10 plus mLs per kilogram for the dogs of salt water into the lungs. And they were like looking at that, where body recoveries of long-term drowning victims they find like 1 to 2 mLs per kilogram. So real life, it doesn't sound like that even makes that much of a difference at all. So the real big thing to be thinking about is cold water versus warm water, because cold water, just like with every hypothermia patient, right? Like you're not dead until you're warm and dead. Right. So we need to consider that.
And then cold also activates that diving reflex as well.
Yeah. Which is it sounds like the laryngospasm is really going to happen anywhere. I think it's just a little more aggressive with the cold water.
Right. Maybe a little quicker.
Yeah. So risk factors for drowning are going to be big ones like we kind of talked about before. So alcohol consumption's huge. Half of all teenage and adult drownings are associated with the use of alcohol. So that's a really big one. And I think most people that have been on drownings that aren't kids or, kid fell in the pool, that kind of thing. Alcohol obviously is a very high prevalence of involvement.
And I think that's why here locally we have the local river that everyone floats, and then they had an alcohol ban that I don't know, was put in a few years back. And I think that was a big rationale behind it, because we were seeing, and just the more intoxicated people you have around water, just the higher the risk. And that's just math. Yeah,
for sure. Actually, one of the drownings I was on was not alcohol consumption, but it was an elderly woman. I think she was in her 80s that her caretaker gave her a bath, and it was right after she took her meds. And so she was on, I don't remember what it was, if it was an opiate or like a benzo or some sort of sedative medication. And so she just kind of like got too relaxed and just slipped under the water and drowned. I would expand this upon alcohol consumption for sure, but even just like substance use in general, I'm sure that number would be even higher.
Right. I've heard that drowning is a peaceful death, and I cannot wrap my mind around how that's any part of that's peaceful. Yeah. It sounds terrible.
No, it sounds really bad. Yeah, for sure.
Not a fun thing.
Pre-existing seizure disorders is another one that's a risk factor, which makes perfect sense if you think about it, right? One of the more tragic calls I was ever on was a teenage girl, and she had a seizure disorder. She was not allowed to take baths because of that, right? They were smart about it. They knew. But so she had gone to take a shower, And after a while, her sister realized she's been in the shower for a long time. So kind of knocked on the door, whatever, didn't get an answer and opened it. And the patient had, we're assuming had a seizure and fell down onto the floor. And when she fell down, she blocked the
drain.
shower drain. And so the shower filled up around her and she ended up drowning in the bathtub as she was laying there post-ictal.
Right. And I think that actually brings up a good point is that, it doesn't have to be a lot of water to be considered a drowning. And that's where it ties back to that neurologic issue and not a lung issue.
Yeah. Yeah. I think it's like 3 inches theoretically you could drown in.
Anything that you can submerge your nose and mouth in.
Yeah. Anything that's going to block air passage into your lungs. Any immersion in a liquid that will block air passage down into your lungs is going to be a drowning. So there's a really good metal band called 3 Inches of Blood, who everyone should check them out if you like metal. But that's the thing. 3 inches of blood, 3 inches is enough to drown in. So that's where the title or the band name comes from.
They used to, another fun fact, they used to call drownings Rapture of the Deep. And I think that would be such a sick metal band
I know.
now.
Yeah, that's pretty rad. That's pretty rad.
Rapture of the Deep.
Geriatric patients with cardiovascular disease we have listed as well for risk factors. And then unsupervised access to water for children obviously is huge. And it's something like around here, we have a lot of canals, which is a big concern. I grew up in Southern California and thankfully I remember, we moved when I was like 16 to a house and we got a pool built in the backyard. And I remember like there were a bunch of inspections where city inspectors would come in and different processes with the pool. And it took a while to get the fence installed. So we had to have these like crazy buzzers on the doors that anytime you had to press it and it had to be at the top of the door, you had to press it before you open the door or it would screech like down the street. You could hear it screeching, because I had little siblings that could get out. So, thankfully there's been a lot of prevention for this, but, one of the big risk factors is like big parties where everyone thinks somebody's watching the kid, but because everybody thinks somebody is, nobody is. And so that tends to be a concern here. I was on a pediatric drowning where little 2-3-year-old was taking a bath and 7-year-old brother was supposed to be in charge and watching the little guy, and the little guy slipped under and, that was another real tragic one. But big brother was like 7 years old. He's not responsible.
That's a
enough to
lot
do
of
that.
Expectation for a little kid.
Yeah. So
I think with prevention too, especially with like nowadays, I saw it in action one time. I worked at a gym prior to being a medic, and they had the infant survival classes there, like swimming survival. And I was touring a potential member of this gym. And as we walked to the pool room, it was kind of funny from like an observing perspective. The instructor just kind of like pushed this kid into the water, and it's like a 1-year-old. So everyone's like, well, what are you doing? But then the kid came up, floated, screaming, crying. And it was really impressive to the point where like with my own child, like I'm going to be doing that. There's a lot of different resources out there now, especially with kids for prevention. But yeah, gates huge, fencing's huge.
Yeah. Around here, there's a lot of like free swim lessons or even if not free, maybe like, if you're low income, you can get into swim lessons for cheaper prices and all of that. And just, I think, because here we have a lot of lakes and rivers and canals and all that stuff. So if you have kids, like, swim lessons are fun, but it's a survival thing. You need to get your kids in those so that they're safe, to go be able to be around water.
And rivers bring a whole other side that we probably won't talk about today, but there's a lot of risk factor with rivers.
Yeah, rivers. For me, growing up by the ocean, like I know the ocean. The ocean's not. I've bodyboarded out in double overhead stuff, and like that's not a big deal for me. But rivers are terrifying to me.
The ocean scares me way worse.
Yeah, it's so funny.
Way worse.
Yeah, rivers are they just don't stop, right? Like I don't understand them as well, but it's a personal thing. So laryngospasm, we kind of talked about it before a little bit already, but laryngospasm is a common thing where when somebody becomes submerged. Like the airway closes up.
The larynx.
Yeah, the larynx closes up. And so that is going to prevent water from entering the lungs.
Which is why you see that low number like of mils in the lung.
Exactly. And so we have like the mammalian dive reflex where, we might see that a little bit if like splash cold water on the face. Like you'll do that a little bit, but that will also happen as we submerge in water and more effective in cold water, like you were saying before. So that is going to help to keep water or liquids from getting into the lungs, right? So, but water and liquids still will get into the lungs. And so even a small amount into the lungs can cause some big issues because we have surfactant in our lungs, right? And so kind of a soap-like substance in our lungs, it helps to keep our alveoli open. It helps prevent atelectasis, which is collapse of those alveoli.
Right. It's via surface tension.
Yeah.
That holds those wide open.
Yeah, exactly. And so if we get a little bit of water down into our lungs, we're going to have some surfactant wash, which is going to allow for that atelectasis for number one. And number two, it really is like soap and it causes a lot of foam buildup, right? And so if we have a little bit of water in there and we're struggling to get the patient out of the pool or whatever it is, we're shaking up that water in, you know, it's like the sink, right? You put a little dish soap in the sink and you agitate it, same thing's going to happen. And so, it's really important when we're talking about this to recognize that there will be foam. That is a very, very common thing in drownings. When they get a little bit of water down into the lungs, that surfactant causes foam. And so foam is going to be coming out of the mouth. So
and nose,
yeah. So,
and it's not like a little foam. I want to link that video. There's a video of a drowning in India, I believe it is, and it's intense. It's a lot of foam coming out, and it's one of those where, like, as providers, our whole thing is airway, and so it's like, oh, I just got to suction. But the thing is you will suction and suction and suction, and it will not stop until you start pushing surfactant back down to get those alveoli back open. Yeah, and it's a lot.
There's another really good quote that I thought I had written down right here that I don't, from all the stuff I was looking from Dr. Semstrat, where it's something to the effect of, like, if you have this foam, you can keep suctioning, you can suction the patient for the rest of their life or something like that, because you're so focused on clearing the airway. And if there's like actual standing water in the airway that you recognize, or there's vomit, because vomit's very common in drowning patients, definitely suction that out, clean the airway out that way. But if it's just foam, just suction through the foam, right?
Bag through the foam.
Sorry, bag through the foam. Don't suction the foam. Foam is fine. It's just the surfactant.
Right. Bag
through the foam. The hospital can manage a patient with water in their lungs and wet lungs. They can't manage a patient with a dead brain. Right. And so if you're so focused on suctioning, you'll suction continuously and their brain is not getting any more oxygen. Right. So that's really important to recognize, kind of the mechanism of drowning. Right. So, it's kind of like asphyxiation essentially. So we need to be able to bring air into our lungs so that air can be attached to the red blood cells and go to the cells in the brain and everywhere it needs to go, right? And so if you're submerged in liquid, it's the same as, putting a bag over your head, right? Like, the issue is that you have oxygen in your lungs and the dead space and all that, and your body's using that oxygen until that oxygen goes down to zero, right? The oxygen saturation is going to go from 100 to 90 to 80 to 70 to 60 and work its way down. And so it's important to recognize that is what the mechanism of drowning is. It's that lack of oxygen to the brain. Right.
That's why it's that neurologic coming back to it.
Yeah, exactly.
100%. Like, and it makes total sense if you think from a physiologic perspective too, of like, yes, the lung, obviously water in lungs is not a good thing, but anytime you're crimping down and restricting oxygen, you're running the risk of damaging, not the brain obviously being the big one, but all of your organs and all of your cells, frankly.
Yeah. And so what patients are dying by hypoxia with this. And so if you think about hypoxia signs and symptoms, you're going to have those same things with the non-fatal drownings too, right? Like, you could pull patients out and they can be unconscious. They're not dead yet. Their heart's still working, but they're unconscious because their brain is starved of oxygen. And so, really recognizing, like, we're not doing CAB for these patients. ABC is where we're at,
right? Because
we need to combat that mechanism of hypoxia with oxygen, right? Yeah. That's the main thing, which we're kind of getting ahead of ourselves a little bit, but that's the main thing we need to be doing.
I think a big thing to bring up too is that even with non-fatal drownings, if they're not hypoxic enough where they start to experience brain death from the water exposure, like think the call I ran with that kid, right? He was okay in the moment, but remember, hypoxia can be a progressive thing too if you're not quick enough or aggressive enough with your treatment. And so it's still going to be, even though he was fine for the most part. It was still a lot of management just to make sure we're not missing things, outside of lung sounds and all that, according, listening to the lungs.
Yeah.
But yeah, because it can be progressive, and sometimes they can have kind of the snap reflex and start having issues again.
Yeah. Be aggressive with oxygenation for these patients for sure. One other thing to think about with submergent incidents is going to be spinal injuries. Those are also very common for these, and especially like, the drunk person at the pool that dives into the shallow end. That's a really common thing for these. So make sure that you're being aware of that when you are going to treat a possible drowning patient. Ask kind of the mechanism of how it happened and be ready to have to manage the spine.
Right. And if there's lifeguards on duty, depending at this pool, they're going to have very specific procedures, for lack of a better term, on how to manage that spine while they're in water. I feel like that's, I don't want to say a disservice, but a lot of us who are like just ambulance medics or even fire medics, it's one of those things like that's a very distinct training set that we just don't have. So
let the experts do their job.
Right. It's the same thing if there's an athletic trainer on the field for sports, right? They know how to take the gear off. Let them take the gear off. There's a lifeguard there. Let them help as much as they can.
Yeah. And another thing that lifeguards are trained in is to give mouth-to-mouth breaths in the water. So they will have they'll have masks so they can do rescue breathing masks so they can do mouth-to-mouth in the water, which is not something we're trained for. But recognize that if you go on one of these calls, you might see that kind of a thing.
Right.
And it's not uncommon. Like one of the many drownings, unfortunately, I was on. One of them was at a swim meet. And so, even though it wasn't a diving incident, lifeguards were the ones that were pulling him out. We were just standing on the deck waiting for them to get over and all that. So you might have that situation where you see the lifeguards giving rescue breaths as they're pulling the patients over. And that's just a well-trained lifeguard. That's what they should be doing.
Right. Making our lives easier. Of sorts.
But we are not trained for that. So it might look weird to you, but they're doing the right thing. They're right on with what they're doing there. So another big thing when we're talking about drowning is going to be responder safety, right? And so, the rule for water rescue is, you're going to reach, throw, row, then go. So if you can reach out and grab them, pull them in that way, make sure you're keeping yourself safe. If you don't, then maybe you have a throw bag, like a rope bag that you can throw out, something like that, or, some sort of flotation device. And then if that doesn't work, you'll get on a boat or something to go get them. And then you're going to go get them. Right. So,
and I think with the throw rope, remember too, is that we don't want to throw it directly at the patient. We don't want to throw down if they're in a river, because that's local issues here. Excuse me. We don't want to throw it at the patient directly. We don't want to throw it downstream of them because obviously they'll never get there. So if you can lead them a little bit, that tow rope is going to be, or bag is going to be a lot lighter than the patient. And so it's going to catch them a lot faster.
But sometimes it's really hard, but you just have to wait for the correct resources. Another relevant story. A couple of years ago, there was so here in Boise, there's the Boise River. It runs through downtown. And so float season, there will be thousands of people that float every day. So you can start a couple different parks, and it's a whole thing, right? People around here float the river.
It is cool, for the record.
Yeah. If you're in Boise, it's really fun. It's really cool. It takes a couple hours, but you can rent tubes, and there's buses that run to get, it's a cool setup. But so, there was a group of people that tied their tubes together, which never do that. That is a bad idea. And it was like 10 or 12 people that tied all their tubes together. And so, you go under a couple bridges, and they went under a bridge, and they kind of hit a pylon of the bridge, and half of them went one way and half of them went the other way. And so they got stuck on the bridge because the water's coming, it's coming down. You can't push up against it. And so, it was a scary sounding dispatch, because the dispatch was like, kids are being thrown into the water and all this stuff. And so, people saw it. So bystanders had kind of like stopped down where it was shallow, and they were just throwing their kids from the stuck tubes, and, grown-ups were pulling them out, like bystanders and all that. So by the time we got there, there were 2 people left on the tubes. Everybody else had been able to escape. But there was a younger teenage college age girl, who thankfully was wearing a life vest, and then 40 something, 50-year-old woman, who was no life vest, and the rope had gone over her waist. And so she was roped onto the tube. And so we got there and they were both safe. You could tell that they had been pulled under a little bit because the current was pulling them slowly. But we just had to sit on the side and wait for the Boise Fire, the rescue team, to come in their boat. And this was a couple years ago. Now I think over summer they are on the boat, like they just sit on the boat
a lot more frequently.
I think that crew, I think they stay on the river all day, at least on the weekends. That is their position. But we had to wait to get the boat deployed, and they have to deploy 2 miles upstream and all this stuff, right? So it was a while. But like there was talk of people like, do we just go in? And like, family members were like, we need a life jacket to go in. I'm like, no, like you are just going to get wrapped up too, and you're going to become another victim. And we had to watch, and it was like the biggest hero moment I've ever seen, right? The boat gets there, the way they drove the boat in a current, right? Like how steady they could keep that boat. And, going upstream, they got next to him. They got the girl with the life vest. They were able to pull her out because she wasn't actually wrapped up. And so right when they did that, the buoyancy from the life vest went away. And so the other woman started you could physically watch her being pulled under, right? And the rope, she was stuck because of the rope. So the fireboat like comes over to drop the first victim off, and everybody starts yelling like she's going under. And so they immediately go back to the other side. Firefighter, like no joke, like the most heroic thing, pulls out his knife and just jumps off the boat with his knife and makes like one swipe and cuts her loose. And like she disappears when she gets cut. And then like 3 seconds later, you see him like come out of the water, pulling her, like swimming over to the edge. It was literally straight out of a movie.
Slow clap moment.
It was crazy. And there's like 100 people watching, like everyone freaked out. It was crazy. But I know, cool story for kind of a long story.
Yeah.
But point being, right, like you need to wait for the correct resources. If we had tried to go in and get them, then we are putting ourselves at risk. Right. And it's harder with kids, right? But they made a decision. It was a poor decision, but they were in that situation because of the decision they made, and we can't put ourselves at risk because of that.
Right. Scene safety always number one.
Yeah, for sure. So, just make sure that you're really aware of that. Don't overestimate your ability as far as swimming goes. And, if you're not trained to go do river rescues, don't try to rescue somebody in a river. Stand on the bank, do your throw bags and all that, but don't put yourself at risk for these. So we covered kind of scene safety, right? Like personal safety, all that stuff. So let's kind of talk about if you have a drowning patient, right? What are we going to be doing for resuscitation for these patients?
The big concept, you already said it, they're not dead till they're warm and dead.
Yeah. So cold water drownings, I'm trying to remember how long it was. There was a training I did a long time ago that they talked about somebody that was like backcountry skiing and went in the water, and they like broke through like a thin ice and went in head first, and they were upside down because their skis were still on their feet. And so they were stuck. I think they were in the water for like 3 hours. And they got recovered. They got pulled out. They got treated, transported, and had full neuro recovery.
Wow.
Like they walked out of the hospital the same person
because of the temperature.
They started. Yeah. And, like your body processes are just slowed so much. Your body can handle that. So, cold water drowning, is definitely a different thing. Not dead until you're warm and dead. And so these are the patients that, maybe transport them so they can be treated in the hospital as they do the active rewarming and all that stuff to see if everything starts going again.
Right. And remember, if you're going to be running, because, if it becomes like a cardiac arrest type call, if they're cold, that heart is going to get really fickle. And it's going to be, when you're packaging, be very careful with movement. Obviously, if we need to slap the pads on, then that's going to be something where we make sure they're dry and that we're not sitting in a puddle of water with them. It's per AHA standards. You can technically, if they're in a puddle, you could still apply pads. From a real life provider standpoint, I don't see why we wouldn't just move another 4 feet away or whatever. Situation dependent, obviously.
Yeah. So think about that. Dry them the best you can. There are times where it's just kind of hard to get them fully out of it. And, there's places now where the thought that, people do compressions hands-on and defib during that. So, you're probably going to be fine, but if you can get to somewhere safer, definitely get to somewhere safer.
Right. Well, seeing safety, a little forethought goes a long way.
Yeah. So make sure you're, like you said before, all the American Heart stuff, all the CPR training now is made by cardiologists for a 70-year-old, 275-pound dude that's like munching on his cheeseburgers and has a bad, weak, sick heart from years of abuse, and then goes into cardiac arrest by going into VFib or VTAC, and then they keel over dead. And so, CAB is important then because we need to like get on the heart. This is a whole different thing, right? They didn't die because they had a heart issue.
Right.
This patient died, went into cardiac arrest because of an oxygenation issue.
Right. Hypoxia causing cardiac response.
Exactly. And so we need to change up our role in what we do by going back to the old school ABCs and primarily focusing on making sure that airway is clear of vomit or standing water, not the foam. Leave the foam, ventilate through the foam, and then working on rescue breaths.
Right.
And so, like I was saying earlier, I think I have another page. This is where I looked into some different protocols, and Utah State's protocol actually lists for in a drowning patient. They say, unlike the CAB strategy used in standard cardiac arrest, patients suffering cardiac arrest from drowning require an ABC approach with 5 rescue breaths followed by 30 chest compressions. Then use a 30-to-2 compression ventilation ratio for adults or 15-to-2 ratio for children. So, and from all my research, that seems like a progressive and what the experts recommend as far as drowning goes. So, and this is follow your local protocols. Make sure, always a caveat with that. But that's kind of where you might see this change, where instead of jumping right on the chest for these patients, because if we think about the body like a car, right? And so if we're thinking about the gas tank being full of oxygen, they've been driving underwater using all of that gas, and now the gas tank is empty, right? There's no oxygen left.
But the engine's still running.
Well, or the engine shut off, right? But if we try to start an engine with no oxygen in it, nothing's going to happen, or no gas in it, right? Nothing's going to happen. Right. And our body's the same. And so that's why we give these rescue breaths first. Get some oxygen back down into those lungs because they've been in a environment where they were starved of oxygen. Get some oxygen back down into those lungs with a couple rescue breaths. And then when we start pushing that blood again through the body, now there's oxygen that hopefully will get to where it needs to go.
Right.
But if you start and you do 30 compressions before any rescue breaths,
we're circulating nothing.
You're circulating you're circulating blood with no oxygen content. And so it's not doing anything. Right. So that is why you'll see that change. San Diego County protocols say to emphasize ventilations and then high flow O2 of spontaneous respirations. So make sure that you're thinking about that for those non-fatal drownings, right? That these patients, even if they're grossly stable, we want to give them that high saturation of oxygen, just like you were talking about before, right? Maybe they're doing everything okay right now, but they can crash later. So we want to get ahead of that.
I remember when we did this training, that felt very counterintuitive just because of every program ever through AHA and all the things. But yeah, it makes total sense, right? Getting that oxygen back in. And I really it was interesting in the training, they talked about the surfactant foam of the reason we're going to bag through it is because worst case scenario, you're putting it back where it goes. And it's like, oh, well, duh. If I think about it like that, you know, then it makes total sense.
Yeah, for sure. And then one other protocol that I found was Fort Lauderdale, Florida. And it says immediate ventilation is a priority. So I was kind of surprised. Even I was looking locally here for Ada County. They don't have a drowning specific protocol. I couldn't find anything drowning looking through their protocols.
But there's that crazy good training for it.
There's an excellent training on it. But yeah, so make sure you're following your local protocols. But if you don't have anything specifically, here's some other protocols that seem to match up with the current expert advice as far as drowning. And the advice and their recommendations seem pretty logical when you think about why we're so big on the ABC, not the BAC.
And if you're somebody who has some leeway in your writing your protocols, it might be worth mentioning just because the current information is all lining up for success with it.
Yeah, definitely. If you have a say in those things, this might be your time to like, push forward and be like, hey, look at this. Here's a new research. Here's what everybody's saying. Here's what the expert opinions are, and maybe get things changed to more match that.
Yeah.
Assessment wise, make sure that, like we talked about before, that you are aware of maybe spinal precautions. And so, you might have to put patients in C-spine precautions. If it's a possible diving incident with an unconscious patient, definitely, regardless of what you're finding, put C-spine precautions.
Right. A little assumption goes a long way if we're going to be patient advocates.
Yeah, for sure. And then, I feel like it's pretty straightforward. After that, you're going to go to your ABCs. We already talked about it a bunch, but don't suction the foam.
Yep.
Give high quality, good ventilations on high flow O2.
Right.
And then you're going to do your typical CPR as needed.
Yeah. Pro tip is make sure you're really drying that face before you give breaths as best you can. Foam is going to get in the way, but if you can dry that face off, because you don't want that seal slipping, because we want to make sure we're delivering good breaths. I also want to emphasize they're likely going to vomit. That airway is going to need support. Obviously we don't want to bag in through vomit. Foam is one thing, vomit's another, because we can cause aspiration. Yeah. But I would also venture to say is it's hard to be mad about aspiration if you're dead.
Yeah, for sure. Yeah, I feel like the treatment part of this, I feel like it's pretty straightforward and stuff we kind of already hit on.
Run the code if it's a code, treat the airway aggressively if they're still alive.
Yeah, and exactly. Oxygenate, ventilate, be on top of that. I think you covered it a little bit, and this goes more into cold emergencies, but make sure you're aware of your protocols. You might have some staggered defibrillation intervals. And
remember the rewarming stuff too can be different depending on temperatures and things like that as well. Because the hospital is they don't want you to super aggressively rewarm somebody, because they're going to do a very maintained and maintenance rewarming of them. The big thing is can we bring in a viable body?
Yeah, for sure. Cool. Anything else you want to add?
No, be safe out there. Careful if you're going to drink and swim.
Yeah. Or just don't.
Or just don't. That's a better answer.
Yeah. Make sure there's a responsible adult. No matter who, if it's kids or people out drinking at a pool party, like at least have one responsible adult that's able to get people out of a pool and is watching as needed. Or if you are around a bunch of kids, designate somebody as your person, right? Like right now for these next 30 minutes, your job is to watch the children.
Right.
Don't just leave them. Even if, they know how to swim, like maybe they trip and they bonk their head on the edge of the pool and then fall in or whatever. Right. So, don't leave them unattended. Adults drinking, children, which are kind of the same thing in some ways.
A lot. Yeah. Will you be my responsible adult next time we're at a pool party, please?
Oh man, I don't know if I could stand next to that Adonis body that you got. It might be embarrassing.
Okay. Flattery's working. It's working again.
I know. I had to make up for last time, Now we're even though. Now we're good. It's done. It's over. No more of it.
I need you to hurt my feelings more now. It's too far.
Cool. Yeah. Well, like Wade said, be safe out there. Make sure that you're not doing anything stupid as a responder, right? Let the people that are trained do the hero stuff. Don't do anything you're not trained for. Cool. Have a good summer out there, because you know what season it is? It's trauma season, baby.
It's trauma season.
Summertime's trauma season. So thanks for watching. Thanks for listening. Go ahead and check out the YouTube channel, Summit Healthcare Education, Basically EMS podcast channel. We just released a new podcast channel under Summit Healthcare Education. So if you watch the YouTube channel, you've seen we have EMT lectures. We now have those in podcast form under Summit Healthcare Education. So that way you don't need to try to watch them off YouTube. You can go Spotify, all those things, Apple Podcast, all of that. So if you want to, at the gym, while you're driving, all those things, if you want to be able to listen, you can access them there. Hit subscribe if you would. We love it. Hit some comments, some likes, all those things, and we will catch you guys next time.